Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
Claim your life.
I want to tell you something that not everyone knows about me. I am a physician and I know the system from the inside out, and still I was dismissed by it. When I was in medical school, I was sick, and I was told when I went to the doctor after losing my hair, experiencing joint pain like I had never had before, and fatigue that was so bad that I could barely get out of bed, that I was just stressed because of medical school. Well, ultimately, after going to several doctors, I found out that I have lupus and a clotting disorder. And then years later, I had just delivered my second child via C-section, and I was in the recovery room, and I knew that something wasn't right. And when I voiced that, I was dismissed and told that I didn't look like anything was really wrong and my vital signs looked normal. Because of that, I almost lost my life if I wouldn't have advocated for myself. So as a doctor, I know what it's like to be dismissed and not to be heard. Even when you are around people that know you, your colleagues, and you have what is considered the best access in the world, you can still be dismissed. So when I talk about medical gaslighting, it's important to give that context because often people don't realize it is real and it is happening to people every single day. I am so excited to bring on my guest. When we talk about gaslighting, there's so many different areas to it. And the guest that I have is someone who brings medical gaslighting to a new level in a way that reaches people in a way that I had not experienced until I had the opportunity to read her fabulous book. And so I'd love to introduce you to Ilana Jacqueline, who is a patient advocate and author of 2 books, Surviving and Thriving with an Invisible Chronic Illness and Medical Gaslighting, How to Get the Care You Deserve in a System That Makes You Fight for Your Life. At 19 years old, Ilana was diagnosed with hypogammaglobulinemia. For anyone who doesn't know, that is a condition where your immune system doesn't produce enough immunoglobulins, and the antibodies that your body normally uses to fight infection just aren't there. You can look completely healthy on the outside, but in the inside, your body is fighting constantly. And that invisibility is exactly what it means when we talk about how easy it is for people to dismiss based on your outward appearance. And from all of her experience, she wrote 2 fantastic books. And I am so excited to welcome you, Ilana, to Beyond Clinical Walls.
Thank you so much for having me. I am such a big fan of you and all of your advocacy work. I mean, I found you on Instagram and TikTok, and I've been following you there forever. And I'm so excited that you're going to be joining me as my shelf neighbor soon at bookstores everywhere. And I think that's wonderful, the work that you do. And I'm so happy to be on your show.
I am thrilled to have you. I like to start with a little rapid fire. Are you game?
Let's do it.
Okay. All right. So if all the hours you have logged as a patient could be converted into a medical specialty, which department are you walking into?
Wow. Okay. So, well, I can tell you it would not be the Department of Patient Advocates, because if there was, it would be that my job was done wrong. My belief is that patient advocacy, which, defense against medical gaslighting, these are skills that every patient and their caregiver can learn and act on. And all the ways in which I've been teaching advocacy throughout the years, it's really all been in an effort of not needing someone like me to be next to you in the exam room. My goal is to train patients and caregivers to feel empowered to act on their own. So hopefully I would not be in any department. I would be I'm waiting back in the car for you, honey.
Great answer. So you have used your voice to bring this conversation to huge platforms, including Cosmo and Lifetime. What is the coolest experience you have had so far doing this work?
Oh, that is a great question. I've been very lucky to have some great media spots to be a subject matter expert on this. But I think my most My most fun experience was just after my book came out last year. I got this email from three three girls in high school, and they were doing a group project for class where they had to like present a social issue and educate their class about it. And they emailed me and they were like, we want to interview you about medical gaslighting. Like, could we send you some questions? Could we schedule a call? And I was like, yes. So I like got on a call with them, and they were so smart, and they asked so many great questions. Like, I they just they really opened my eyes and just like made me feel like the next generation, they're just going to be gaslight proof. Like, they are wide awake and they are not like going to take flack from anyone. I love that experience, just getting a chance to talk to them and to know they were going to pass that along to their classmates. It was so cool.
That is beautiful. Like, yes, gaslight proof. I would like you to coin that.
Yeah.
That is awesome. That's fantastic. If you could wave a magic wand and fix something about our healthcare system overnight, what would you fix?
Oh man, I'd fix the power imbalance, which I'm sure we'll get a little more into, but I would do that by rebuilding trust on both sides of the exam room. Like, right now, patients feel like they have to prove that they're credible, and physicians feel like they have to verify that credibility before they can move forward. And that tension, it didn't come from nowhere. It's really been shaped by like real pressures over the last decade. But it does raise the question, like, what would care look like if we didn't have to spend so much time assessing patient motivation and could instead focus on delivering care in the such short amount of time that we have in the exam room?
Let's build on that. I mean, what you said is so powerful. It's like often people are not aware of all of the intricacies that are at play when you see your doctor. There are so many different things that happen from the time you sit down and that clinician walks in and how that exchange happens. And this power imbalance, I love how you said that. I call it like a power dynamic,
Yeah.
that happens and how that can shape the outcome. Let's get into the meat of it. I'm ready I have all of these fantastic questions and I'm so excited to help the listener out there that I know is thinking about this as well. So you have, already written a book about the invisible chronic illness, but what was the moment you knew you needed to write specifically about medical gaslighting?
So I think with my books, I wait for the topic to like strike me, and I feel like once I see it, I'll know it. So I went where the strongest response was with this one. I was making all types of content on social media about like a variety of patient topics that were important to me, like things I'd experienced. And so one of my videos was about going to the hospital with excessive bleeding and not being believed or being questioned and not getting the care, and kind of going through like this laundry list of like things that I wanted to be checked off on my list of like emergency situations that, I could go home and feel safe and secure. But I remember like I came home, I had thought about that video. I came home, I threw on my my green screen and my ring light, and I just spontaneously did this video. And I remember like not looking at my phone for like an hour. And then when I finally did, there was almost 1 million views. And I was like, what just happened? So that video it ended up getting like 6 million views almost overnight. And I think the video did so well because I was so passionate about the topic. And the next day, like I thought about it and I was just brainstorming, like, what more can I do with this? It's so relatable, but I never want to write things that are just relatable for the sake of relatability. Like, that doesn't help anyone. I wanted to look at the topic and really think about what are my best tips and my best advice, having lived through this for years and years, that would be the most helpful. And so when I sat down with my publishers about what I wanted to do, I was like, I want to save lives. Like, I want to write a combat guide. Like, this is not a beach breed. This is not like just some sad patient story. I'm like, I want people to read this book, understand medical gaslighting, and go out there and defeat it, like get around it, bypass it, outsmart it, like a survival guide. So that's kind of what we landed on.
Well, what was so refreshing for me, I mean, there's a lot of pieces, but you really highlight, the symptoms, the different aspects that are a part of medical gaslighting. And it takes me back to that video that you did. You were showcasing all of the areas that affect you. Are there certain, there's so much, but like any symptoms or different things that someone listening right now could think, I just had a doctor's appointment. I feel like I was gaslight.
Yes.
Anything that someone could hold on to right now, just as they're listening.
Yeah, I think there's some great there's some great catchphrases. You're gonna hear them over and over again with medical gaslighting. I'll kind of go through them, but when I was writing the book, I put them all down to 4 different types of excuses to not treat. The first category would be like mental health and stress excuse. So that's when like a physician blames symptoms solely on your mental health or stress instead of attempting to perform any kind of testing or address those concerns. So for example, in that category, it would be like, I think this is all in your head, which I'm sure we've all heard before. And the next one would be alternative motives excuses. So that's when your doctor believes your symptoms are in avoidance of something, and they believe it's something that they believe that you perceive is a chore. So like going to school, or even just like things like having sex. So they might say like, does sex really hurt, or are you just not attracted to your partner, or do you just not feel confident in your body? And kind of going to just, what is your motivation for being here and requesting help? And then the next one might be limited data excuses, which is when a physician has performed a minor amount of testing to diagnose the problem and just doesn't want to pursue anymore. And they might say something like, your basic blood work or your imaging, it's all normal, so you must be fine, instead of having that conversation with the patient and being like, we can explore more, or like this would be the next step. And then the last one would be comparative excuses, which probably are some of the hardest to hear. And that's when a physician compares your symptoms to be less severe or impactful as they are based on unrelated cases, which, like, you could imagine a doctor saying to you, there are people in the waiting room who are much sicker than you. I don't want to waste my time on this. Some of the hardest excuses to hear when you're already in so much pain and you're looking for help, and that's the response that you get.
Let's dig into that. The things that you said are spot on. These are all things that I have heard my colleagues, I've seen, I've learned in medical school. And the shift of versus let me listen to what you are telling me, let me clear a canvas in my mind and do what I'm supposed to do as a physician, which is I talk about the differential diagnosis of
Yes.
ruling things in and ruling out. And that is what I'm supposed to do based on the symptoms that you share, not redirect the conversation and not redirect blame or say, I have to go and see a bunch of people. That is not what we are there for. And we just talked about the verbal. Let's dig into the nonverbal language. I love how you talk about that too in your book.
Yeah, I think for nonverbal, I mean, the basis of all this, it's medical bias, right? There has to be something to judge. So something to cling on to in order to form an opinion about who you are, why you're there. I talk about in my book, like you can't hide a lot of things when it comes to medical bias and things that you're being judged on. You're not going to hide your race. You're not going to be able to hide your ethnicity, but you can temporarily minimize like a myriad of things you can be gaslit about. And that's just in how you present yourself. And I always say, like, I feel bad because it's not the most feminist part of my agenda to give advice like this, but it's good survival tactics. And one of the big things that I recommend is to really be aware of how you present yourself in the doctor's office. And this doesn't always apply to, you're not going to really think about your appearance when you're in the emergency room. So put that out of your mind. But when you go to see a new doctor, a specialist, someone who it's not an urgent situation, I do suggest that you think about what you wear instead of dressing up or dressing down. You dress in like business casual clothing, plain things, nothing with a brand name on them. You hide as much as you can of your personality, or as much as you can about who you are that someone could see based on your appearance. And the reason why I suggest that is it makes the physician have to interview you to figure out more about your lifestyle. And that gives you an advantage to only share details that are relevant to your disease state. It makes the situation so that there has to be some form of collaboration to come to a conclusion. I think that does give a slight advantage to patients. Another tip that I love to give to patients is in the form of affirmations. And I have these all written in my book, but I'll give you a couple of them just to present yourself with some things to say in the mirror before you go to your doctor's appointment, or in the car to yourself before you walk into the office. So one thing you could say is, I am deserving of the care I'm pursuing, even if this doctor doesn't make the choice to help me. And another one is, whatever this doctor offers me is an offer of collaboration and not a command. I have the ability to consent or refuse treatments based on any factors that concern me.
I When I read that, I loved it because it is so empowering and, the mind is such a powerful thing. And so if you can put yourself in a positive state, no matter you don't know what you're going to walk into. None of us know. Every day when we wake up, we have no idea what we're going to face. But what we can do is give ourselves the best opportunity to present and get ourselves through that challenge. And I want to go back to when you said the presentation. When I read that in your book, it immediately took me back to being a child with my being like in my I remember, I think the first visit I went with my dad where I could really recall what was happening. I was probably like 7 or 8 years old.
Mhm.
And for context, my father was an older parent. He passed away just a few years ago at age 99, and he was a triple war veteran, including World War II. Korean and Vietnam. And I went to the VA Veterans Hospital, for those who may not know what that is. And I would see him take extra time at the house and shine his shoes.
Aw.
He would make sure that he had the brightest colors and just really wanted to give the best to present himself. And I think I was 9 or 10. I said, why are you putting all this effort, Dad? We're just going to the doctor. And he's like, well, I need them to take me seriously.
Yeah.
Like that, I'll never forget that. Like that was and these were moments where he did not feel well. And that's what, he was going, but he still knew he wanted to try to give the best effort. And it paints a picture of how much people are going through just to get the care that they need.
It's so true, and what a great example, and a smart man to know that that is something that is so real. Like, I mean, it is going to happen, and I talk with a lot of women who say that they put more effort into preparing themselves and getting dressed and getting ready for a doctor's appointment than they would for a date, because the relationship that you're about to build with someone is life or death. Like, it truly is, and it's sad that we have to do that when we are so sick, but unfortunately, it's part of the work of advocating for ourselves.
I agree. I often tell my patients or people, I'm like, when you find that doctor, it is a dating relationship. And you really want to make sure. My dad had this phrase, both people need to bring something to the table.
Yes,
And so,
absolutely,
and
absolutely.
it's true. And I tell my patients, I'm like, when do you see this specialist? Like, I try to prime them if they're going to see, a new, that person needs to bring, something to the table. You need to feel honored. You need to feel like something is going to move forward. And speaking of forward, we've prepped and primed this person who's going to go see their doctor now. They have all these lovely affirmations and they find themselves in a disagreement with their clinician. What are a couple things that they can do in that moment?
Great question. So, I mean, I think what we want to see is collaboration and transparency on both ends, which is exactly what you just said. It's kind of like a group project, and we really want to see enough give and take. And when it comes to a differing of an opinion, we want both parties to feel encouraged to not just hold their ground, but to defend it. I've definitely gone into exam rooms thinking, I want it this way. I'm going to fight for it to be this way. But I also know that I'm half the equation. And I've built relationships with my physicians. If their argument can stand a pressure test of genuine curiosity, then it's my job to listen and to take that recommendation very seriously. And that's why I try to what I try to teach patients. This is so much harder to do with a new patient and a new doctor making a big decision. I think both parties have to be patient, and when possible, take time to go home and research your options and think about what you're about to do. And if time isn't a luxury that you have in this situation, then it comes down to having a productive conversation. Nobody on either end wants to be told what is going to happen in that room. They want to be heard, they want to be listened to. So unfortunately, I wish I had, magic words or something that was like, this is the sneak trick that you can do to like get your way. But the reality is that you want to do things the right way. You want to have the best possible outcome. You have to remind yourself, I came here for help because I couldn't help myself. And so you have to take that and come with an open enough mind, but as well as having your own position and your own care and knowing that you are number one in protecting you.
And keeping that in the back of your mind, you're number one in protecting you can help provide that invisible line of where you feel this could be medical gaslighting
Right.
and where this could be a difference of opinion,
Yes.
and find that middle point. Because if you keep yourself at the forefront,
Mhm.
that can help you straddle this delicate line that's a part of our healthcare system. And that leads me to, there's so much to be said when it comes to our healthcare system. But what's maybe two things that you wish people knew about our healthcare system?
Hmm. I think, boy, there's so much to know. There's so much to know, and I feel like that does feel like most of my job is just educating, and even what we were just talking about, I had kind of gone through and made this chart in the book where I was talking about like what is what is medical gaslighting, what is normal, and what is just the BS of American healthcare systems. And, talking about things like, oh, when I go to the hospital and they wake me up at 3 a.m., I've barely had any sleep, but they're taking blood work and, why are they torturing me like this? And it's like, unfortunately, that is the BS of the American healthcare system. We have to get blood drawn so that it can be there in time for doctors to check you out during their 6 a.m. rounds before they go and work their full day versus something like, the doctor just told me that they don't care what I think, or they're moving ahead and they're not making decisions with me. Like that could be medical gaslighting. So it's a lot to kind of untangle between why things happen and why we feel as vulnerable as we do as patients. And I guess the second thing that I want patients to know, just moving right next to that, is that you have to put in the work. It doesn't matter if you're getting a boob job or open heart surgery. Like, it doesn't matter if you have mental health issues. It doesn't matter if you have trouble communicating and picking up the phone. It does not matter if you're like on your deathbed. You still have to be the one who gets an appointment scheduled with palliative care. And you still have to be the one to have your insurance card ready. I want patients to know that, like, unfortunately, no one is coming to roll out the red carpet for you. There's no state of physical disintegration that you're in that excuses you from the work of advocating for your body, which is why you have to prepare yourself for the hard times. You have to kind of think a step ahead and make sure that, you know, in the same way that you might pack an emergency hospital bag, you have to kind of like pack your emergency advocacy skills, and you have to lock in. And it's sad, it's tough, but it feels like no one wants to point this out, but like it feels unfair, but people can and very much do shoot the messenger when I bring this up. But the healthcare system is not capable of advocating for you on behalf of itself. It barely exists to treat you, so you have to do the work.
It's an unpopular opinion when you highlight the fractured pieces that are in the healthcare system. And to your point, it's something I hear often. Well, the doctors should just do better, or this needs to improve. And I don't discount that, but I also say, this is what you can do, because at this current moment,
It is what
it
it
is
is.
broken
Yeah.
and you've got to figure out what you can do to move through this system until one day. And I hope, you hope, that it's not like this, but focusing on what you can do, I think, needs to be more of the narrative. And
Yes.
that's what I love, with what you're doing. So here's a reality check. A 2022 study published in JAMA Surgery found that patients operated by a female surgeon were 16% less likely to experience post surgical complications and 32% less likely to die. Same procedure, different physician, dramatically different outcomes. Now, when I decided to prep and put this article in, and I always say, I should say JAMA, I always say go back and forth. I remember reading in your book how there was one encounter where you were going in for your procedure and it was a female physician. I won't go, too hard, but I thought about that because yes, there are better outcomes with the study, but we also have to
Yeah.
make sure we highlight what gaslighting can happen as well from the same gender. From that study that I mentioned, also providing some context to what you have lived through and experienced, what's the biggest takeaway you have knowing from that?
Ask so many questions. You have to be so intentional about choosing your surgeon. And the experience that I had with a female surgeon, I had a central line, a port that most people get for cancer. I had it for all my other medical issues. And unfortunately, it was infected. It needed to come out. I had a really traumatic experience where I had it taken out without anesthesia and without numbing or anything. I was unfortunately very wide awake, and I was advocating for myself the entire time, but I unfortunately was not heard and suffered a lot from it. It made me so aware of one of knowing that I can say no at any time, that I can not sign the consent forms, that I can say I'm not interested in doing this. I need more time. I need to think about it. I want to know more. I felt when that had happened, I was so young, and I didn't know that everything that I know now. It's unfortunately sometimes you have to go through these experiences and learn, really learn to find your inner advocate. And that was a situation that made me realize, like, boy, you thought you were tough, you got to be way tougher. You got to be way tougher. So be intentional about choosing your surgeons. Don't just settle for the first physician to agree to do it. Now I've had dozens of surgeries, some of them emergencies, but if you do have the privilege of time and of choice, it's time to really buckle down and do the work of investigating the person who you're trusting to take a knife to your body while you are hopefully unconscious. So that's something that's something that you do want to do the research, like check for malpractice, check into the reviews, speak with other doctors who are in the same network as this surgeon, because other doctors and other nurses especially will give you good advice on who you can trust.
I was in tears when I was reading that section, and I could visualize just as a physician when you were like, I think it was like you got another fever, you were sitting there and they were going to decide you were supposed to have it scheduled for later,
Yeah.
and then all of a sudden they're like, we can do it now, and in my mind I could picture that entire scene happening because I see it all the time, in the hospital, and my heart was just breaking for you because all of the steps, and anyone who hasn't read her book, you need to this story is one that every person needs to read. I could just my heart just it was just broken for you, and it still catches me to this day what you experience and how again we have to, advocate. I loved how afterwards, and with a lot of the trauma and the medical gaslighting that you've experienced, you've brought up something that a lot of people do not know that they can do. And that brings me to another JAMA study that showed 1 in 5 patients who read their own medical records find errors. Let's showcase, what can you do to find medical errors? How do you even access your medical records? A lot of people have no idea that there's a lot of information there that can help you push back.
I am a dog with a bone with this topic. Like, I am so um forceful with this topic, especially with my entire family. And all of my friends. I'm like, you need to get your records. Like, you need to look at are you logging into MyChart? So so you have two levels of transparency with medical records. You have what is readily available to you on, and I'm gonna say MyChart because it is the electronic medical health record that the majority of hospitals use, and I guarantee you if they're not using it now, it's just a matter of time. But if your doctor does have any sort of electronic medical record, sometimes you get an emailed link to you. It might be something else, but let's stick to MyChart just for the sake of this conversation. So you have what is readily available to you on MyChart, and as long as you have your logins, you can easily access both the visit summary and your clinical notes. So every time that you have a doctor's appointment, that gets updated, and you want to go through the visit summary and you want to look at all of your medications that they have listed there, and you want to look at all of the allergies that you have listed there. And the reason why you want to do this is because one day you might fall on a rusty nail and it is an accident. You go to the emergency room, you have a nail in your leg. You're not really thinking about anything but the fact that that hurts so bad. And they're asking you, and triage, hey, is your medical record up to date? Are your allergies up to date? Are your medications up to date? And you're probably just going to be like, yeah, please get this nail out of my leg. And that is unfortunately where you're going to have an issue of maybe you don't have that antibiotic that you're allergic to listed on your allergies, or maybe they're not seeing that the medication that you're taking is contraindicated for the nail that is in your thigh and whatever treatment they're going to do for it. I want people to really recognize how important it is to update, and you can go in and you can make adjustments yourself. You can request that things be removed or things be changed, or when you're going to a doctor's appointment and you sit down with the nurse before you see the doctor, that is a great time to update your chart, make sure everything looks good. So that's the visit summary. And then you have the clinical notes. And the clinical notes are it's the diary entry of your doctor appointments. It's everything that the doctor and you discussed and everything that they understood to be true. And it's so important to go in there afterwards and take a look, because the amount of times that you will go to the doctor thinking that you had a conversation about giraffes and the doctor thought you were having a conversation about elephants is very high. It
Yeah.
happens all the time. And, it's for a variety of reasons. Doctors are just overburdened with so many patients. Like they have so many things to record and to put together after you leave. And so sometimes all the details might not be in there. Sometimes there'll be details in there that might not belong in there. And you can always call and get that, make sure everything went down the way that you thought it went down. And it's a good way to tell, is there language in here that is maybe not as flattering to the issues that you're dealing with? And you can find some of those lines of medical gaslighting, I think it's probably stress, or this is where you might find those if they weren't said out loud. And that can make a huge difference, because when you go to your next doctor, they get all of that information. And so before you walk into the room, now they have that picture in their head of who you are based on what the last doctor thought. And if the last doctor thought that you were faking your symptoms, or that you couldn't be helped, or that something else was wrong that was not the issue you came in for, now that new doctor has it in your head. So the well can be poisoned very easily with electronic medical records. And it's really our responsibility to go in there and make sure that everything is clean up to date. And then secondary to that, that other level of medical transparency with medical records is you might go to the hospital and you might have, like if you're me, you're going to go and have multiple multi-day trips to the hospital that you're staying in for. And one thing I didn't realize was that there are notes that nurses leave in your chart when they're in the hospital and they're taking care of you. They'll be like, patient
Mhm.
is fine. A patient was sleeping, didn't request their pain medication, must not be in pain. Things like that. And you want to make sure that you're seeing what they're seeing, because very often, your doctors, again, they're coming to see you at like 6 in the morning. They've got 10 other patients to see in the hospital before they start their day. They are heavily relying on what the nurse is telling them and what the nurses are writing down. So if the nurses don't have an accurate view of how you feel, and again, guess who's also overburdened? The nurses. They've got so many patients. So there's so many ways that your characterization of your body and your disease can be misconstrued along the way. It's like a game of telephone, but it's life or death. I really recommend that you get familiar with your medical records. The ones in the hospital, those records, it's a higher level of transparency. It involves a little bit more intricate of a process than just logging in. You have to contact medical records, specifically request all your notes. And I have a template for this on my website on ilanajacqueline.com, and it's free. You can go in there, you can get like the full step-by-step how to request that. And I wanted that to be just totally free so everybody knows how to get it, because I really believe that it's a big deal. It's a great way for medical gaslighting to become this infectious virus that lives on in your records.
It is a walking reflection of your health, whether it's accurate or not, it's there.
Yes.
And I love how you mention with the nurses, because I'll tell my patients if they're hospitalized, yes, you really want to make sure that if you can on your MyChart and you can see what has been released, look at that, because it does paint the picture. There's the pain scale. There is, how much did they eat or drink? Maybe you didn't like the food.
Yeah.
Well, it could look like oh, she, is having issues with tolerating food, or let's talk about the flip side.
Mhm.
Maybe you ate a lot but it just didn't settle with you and you're still having some GI issues. All of a sudden, oh, she's eating well. She
Yes,
must not have the stomach pain.
exactly.
So there's a lot of things that can play. And the last thing it made when you were sharing that story, I had a patient who I had seen during my urgent care visit, and she had been experiencing a cough and shortness of breath for a while. And everyone just kept giving her an inhaler and an antibiotic.
Mhm.
Well, I'm seeing her for the first time and I'm looking at her chart because what I love to do is I'll actually go over and voice what I see in your chart just to make sure we're on the same
That's
page.
so helpful.
Um, I love that. And so, what I'll do, the big thing is, of course, the name, just to make sure I'm in the right room.
Mhm.
I also go over the allergies and then I go over your past medical history and just say, this is what I see. And as I said out loud, "Well, you have COPD." She was like, "What?" And I said, "COPD." And she was like, "I don't have that." And she's like, and then her follow-up was, "What exactly is that?" So then we're having a moment, both of us, and I explain, and fast forward this whole time for about 7 months when she was going to other urgent cares in different places, they were treating her with, for those who don't know, chronic obstructive pulmonary disease, which often you will give an inhaler
Mhm.
and, completely different. So I get an x-ray. She has a tumor, a mass on her lung, cancer, the whole caboodle, but that just is an example of how a delay in care because of the wrong thing in the chart. And then as physicians, as clinicians, I talk about this too. We just kind of go, oh, well, you have this. It must be connected to this. For example, you're coughing. It must be COPD
Right.
because I see this in your history. So those were all fantastic points. I just want to like snap with everything that you were saying. So now that we've kind of painted a picture of, all the challenges, all the things, is there, one healthcare worker, one experience that made a difference for you? I love how you shared the story with the girls in high school who elevated and asked you to come and you were their project. But I'm curious from a healthcare standpoint, is there anyone that has made a difference?
Yeah, I mean, there's so many. I think if you read my book, you'll see I've had some very bad experiences, but at the same time, I've had some wonderful experiences. I've had some doctors who, I mean, I feel like have made such a huge difference in my life, especially when I've come from other doctors who did not make a positive impact on my life. For one, I'd say my current pain management doctor, and pain management is something I talk about in the book
Mhm.
for quite a bit. I mean, we're coming out of the opioid epidemic. It really has changed everything about pain management and how patients are treated. So my current pain management doctor, uh, the difference with him is just that he's so honest with me, and he'll say, "I don't know," and then he'll actually think it through with me. It's a brainstorming session on like what can we do, and as we kind of like work together, we both come out with different, he comes out with new data that he read, and I come out with new symptoms that I forgot to mention, or or old medications that I tried that might have not worked. And I've just had moments where he's told me, like he was up at night considering my case, or like waiting for me to call. And he doesn't rush to extreme interventions, which for me at this point in my life is so crucial. Like there were so many things that I did in my 20s because I was terrified and I was sick and I was in pain, and I didn't know that I would make it to 30. I didn't know I would make it to 36. So like I wasn't thinking about my long-term health, and he's been so wonderful at helping me, remember and keep in mind that like I'm going to stick around for hopefully quite a few more decades, and we really want me to be making choices now that I'm not going to regret later. Like just like I've regretted choices in my 20s, I'm not going to regret choices in my 30s because we really thought about it together. But I think more than anything, he takes the mental load off of me as someone who has to
Mm.
handle all of it, individually. I don't feel like I have to fight or be believed or figure everything out on my own. And like that kind of trust, it changes everything.
Well, and I'm curious, when I hear what you're talking about, I wonder about, I focus on collaboration as far as collaborative language, trying to have that partnership. So, any tips or tricks for someone who is looking for that type of relationship that you have, where someone who is, very intentional and forward thinking, but making sure that you're along for the ride.
Yeah, I think it's a matter of, again, we come back to dating. It comes back to the idea of like like, is this person right out of the gate, are they like primed for a relationship? Are they like ready to interact with me on a level that's going to be great for both of us? Or, so I think some of the tricks and tools are knowing when a doctor is not that, when they are, maybe you are like the last straw on the camel's back before their caseload just collapses in on them. And that can be very clear if they're rushing into the appointment and rushing back out of the appointment, and they get annoyed if you're trying to ask more questions or, slow things down a bit so that you can understand things. And I think that the second part to that is if they are able to come to the table, have a conversation with you, that they are looking for a back and forth. And I think that's just a lot of testing the waters of like, if I mention that I did some research on this, what is the response? Is the response, that's not your job, that's my job? Or is the response, that's great, tell me about you, what you learned, or like tell me if that's, something that you're interested in. So I think it does come back to a lot of dating. And then I think just in terms of like managing multiple chronic illnesses, it's a lot of, in my experience, it's a lot of trusting yourself to make smart decisions when you are at your most competent.
Mm.
I know that, Friday night at the end of a long week is not the time. Like, it's not the time for me to be like making all my appointments, filling up my weekly pill box when I'm at like 0%. Like, I shouldn't, there's so many things that I shouldn't be doing to prepare for other things in my life, but I do a lot of like preparations. I see a lot of TikToks that are like the high maintenance things I do so I can be low maintenance for the rest of the month. Like girls getting like their eyebrows done, and then like microblading, and then doing their face mask, all that stuff. But I think that goes the exact same way for people with chronic illnesses, where like you do a high maintenance task like me, and that could be having a great conversation with your doctor, and then looking through your notes and making sure everything was said and done, and then making sure that you're both on the same page, so that when you're in the middle of a pain crisis, you're not trying to figure out what was said in the game of telephone. So I think it's a lot of, trusting the most competent version of yourself when you have the least amount of symptoms to do the most amount of work.
That is so valuable. I love that. Like, yes. So, what's giving you hope right now about the healthcare system?
AI. I've spent the last couple of months actually studying just across the board, like what is happening with AI and patients. And I think across the board, AI is going to reduce everything from like wait times in the ER to drug development to disease awareness to just the basic day to day for patients trying to get through life with multiple chronic illnesses.
Well, Ilana, thank you so much for joining me. This was a beautiful, delightful, just engaging conversation. And I love the work that you're doing, and it is so needed. I love how you have this ability to connect to people, which are patients. We're all patients, and that's what you're doing with your work. And I just want to say that your work is powerful and it's helping people every single day. So thank you so much for taking the time to join me. Any final thoughts?
Just thankful for you as well. I'm so excited about the work that you do, about the way that you shine the light on so many people doing great advocacy work. And I'm so excited to be here. Thank you so much for having me.
Oh, thank you for joining me. This will be part one. We have to have this. We'll
Oh yeah.
figure it out in the future. Maybe an IG Live. We'll have to figure out some fun ways to continue. So
Yeah.
thank you. You can find Alana's book, Surviving and Thriving with an Invisible Chronic Illness and Medical Gaslighting, wherever books are sold. Both are also available for free at libraries across the United States. Everything will be in the show notes, her website, Instagram, and TikTok. Did something in this episode click for you? Please share it with someone who needs these insights too. Because here's what I need you to know: you are not difficult, nor are you too much. You deserve a doctor who believes you. You have more power in that room than you think. You've got this. Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.